Same day total joint is interesting because it's quick and over. It's not a long going process. I originally heard that some stay the night. The Dr. Bremner says I would be going home that day on crutches, and I didn't squabble with him about being on crutches for 2 weeks. That's fine. After I understood the whole healing process, I'm in constant pain. Right now I'm just limping, but you see me in 2-3 hours and I'm dragging a leg. I'm having to sit down. It's just excruciating by the end of the day. The reason my hip has gotten so bad over the years is 40+ years of wrestling through school, college, coaching, and just quit doing that a couple years ago. The next 2 weeks is just gonna drive me nuts. It's like, why can't it be done right now? That would be the answer. I need to be out of the pain. I can't sleep at night.
The actual surgical procedure is very similar to what you'd have in the hospital, same type of implants. The approaches to the joint might be more muscle sparing or minimally invasive. The anesthesia component of it is less dependent on narcotic or opiate pain medicines, and that allows us to awaken the patient faster and get them walking within hours. So risks with the surgery are the same as at the hospital. We think that there's a less risk of infection because of the more healthy patient population at a surgery center compared to the hospital. There aren't any special risks about this doing it at a surgery center. We do have to make sure that we pick healthy, motivated candidates for the procedure, so not everybody is a candidate for the outpatient procedure, and you also have to have help at home that is motivated to help you.
Right now my pain level in my hip is 0. The only pain I have is I can feel the steel rod. I can feel that. And the skin's still a little sensitive around it, and it still feels warm. But all the pain is now in my femur. Nothing's in my hip. There's 0 pain in my hip now.
But he's doing great, and the thing I like about sending people home is recovered in their own home. Like he said, you're going to be uncomfortable in the hospital or you're going to be uncomfortable at home. Most people, once they kind of ahead of time get it in their head that, I'm going to get through this and, I'm motivated to do the exercises, then they're going to do really well when they go home. The other things, the things I like about doing it as an outpatient is less risk of infection. But you should be able to do stuff, biking and hiking and tennis, and maybe a little bit of demonstration in the wrestling room on how to do takedowns and stuff like that, just within reason.